Ms. Hoover, what I wanted to ask you was, you're probably closer to this than a lot of people because of being our health director, but that was really good news about the 10 tests that came back negative. How many tests do we have that's still outstanding, or don't you actually know that yet?
We do have a number that is out there. We are reluctant to give you a number because it's constantly changing. We will hear and have conversation with our partners at Base and at Onslow and with our community providers, and they are constantly calling us seeking guidance for whether patients need to be tested, and so they will indicate to us verbally that they will be submitting paperwork for another person under investigation, and that is the terminology that we're using for someone who is being tested.
Okay, my next question would be, what of the people that come back negative, that was tested, that come back negative for the coronavirus, what were the symptoms on the ones that came back negative compared to the ones that we haven't got back yet?
So all of the symptoms for individuals who were tested are similar in nature, that they would have fever, they have respiratory symptoms, cough, and that is very common right now between allergy season and between the flu season that is still ongoing. Those are symptoms that we're seeing a lot of, but that's the criteria for being tested, is that you have a fever, you have symptoms.
And the other question was the one that we do have that was positive on Base, how long will it be before that person or individual is cleared to get back into the regular walks of life?
So at this moment, and that is something that is updated continually too, so at this moment, the guidance for clearing someone who is isolated, has been confirmed as a case, is that they must be symptom-free, and there is no longer a requirement that they have clearance laboratory testing. There's two options. There's one avenue that you can pursue where they do have labs that get cleared after a certain number of days, or they can be symptom-free for a certain number of days, and it is stated as whichever is longer. So there is some guidance that is there for that. But for the individual that is currently our presumptive positive case is being monitored by public health on Base, and they are following that individual.
Is that person getting better, or we don't know, or?
That they're being followed by public health on Base, and so we don't know all of the details of that, but if there were any concerns about deterioration of their condition or not improving as expected, I trust that they would have told us that. As far as we know, they are still at home, which is a good sign, and there has been no need for an increased level of care.
Well, that's really encouraging, because the test that we did get back, the 10 that we did get back was negative, and that was the reason for asking the question about why we tested the other ones that hadn't got back yet and the symptoms. It gives that's some of the questions I get as an official is, how soon are we getting the test back? Why is it taking longer to get the test back? And has the ones that got tested and come back negative, are those symptoms the same as the ones that we haven't got back yet? So that's really encouraging, and it's good that we're putting that information out there through this meeting, for one thing, to let people not get in a situation where they're afraid to even leave their home to go grocery shopping.
Absolutely. The last thing that we need is for everyone to be fearful. We need people to be practical and prudent in a lot of their behaviors, but the guidance that we have put out really is practical at this point. The good hygiene messages and social distancing are all things that are simple for folks to accomplish, and we just need them to adhere to that guidance.
I have a question for you, though. Going with the chairman, though, I know you use the parameters of the symptoms, people that are symptomatic of this particular virus, which can mimic other types of conditions. Are there other parameters that we're using? Because I'm looking at it from Onslow County being a very transient county, with the military being here, with people that are coming in and out of town. I mean, are there any other parameters that we're using to screen certain people for testing, i.e., like, where have you been overseas, where have you been, et cetera?
Absolutely. So some of the epi-linked factors that are different from the clinical factors, the clinical factors would be those signs and symptoms that we see of fever, respiratory symptoms. You have to have some type of epidemiological risk factors too. That might be travel to a high-risk area where we know that there is ongoing transmission, and that list of countries is long. It could be contact with a confirmed case. We know that that has been of a concern here since the case that we do have had contact with a confirmed case. So those are factors that are being assessed in these individuals when they are screened for their need for testing.
What makes this so difficult is it's already in allergy and flu season, and a lot of people that may have some symptoms, they feel like that they may be subjected to somebody that, especially if they've been in contact with somebody out of state or something like that. So I think that's where the big problem is. Do you think that the warmer weather has anything to do with it coming, or?
We hope that the warmer weather will be a benefit to us. We know that a lot of other respiratory viruses that we see are less active during those warm months. A lot of viruses are less stable at warm temperatures and less infectious, less easy to spread around. So we hope that there will be some decrease with the warmer weather, but it's too soon for us to know. We haven't seen this novel coronavirus in warm weather so far, and so some of that we are going to learn it as we live it.
I know the virus is spread through droplets from the membranes. I get that, these membranes, sneezing and such. That's why we're doing the social distancing. Has there been any tests whether or not this virus is airborne? And how long is it airborne for?
So when we think about respiratory droplets, whenever we look at it on a microscopic sense, these droplets are large, heavy droplets that would have a shorter distance that they could spread. That's the reason for the 6 feet perimeter that we think about. When we think about airborne diseases like tuberculosis and measles, these are much smaller microscopic infectious particles that can stay suspended in the air for a period of time. So when we think about coronavirus, we're thinking larger, still microscopic droplets that will settle out of the air quickly with only a spread of 6 feet. Other airborne infections may stay suspended in the air. You could leave the area, come back into that environment, and it's still suspended in the air, and the risk there is inhalation. We don't believe that that's the primary route of spread for coronavirus. However, in some settings where you would be doing aerosol generating procedures, such as in inpatient healthcare settings, in hospitals, whenever they are performing bronchoscopy on patients, doing certain breathing treatments on patients. Those are settings that are higher risk, and those are the settings where we would advise a higher level of PPE. So that is the difference in the requirements or the advice for an N95 fit-tested respirator versus a surgical or a face mask. Does that make sense? I hope.
It does.
Okay.
It clarifies why we're using sanitizers and stuff like that. Because, like you said, it falls out of the air, it's on the surface and stuff like that. So, that explains it a lot.
And there is some risk of indirect transmission. So if a surface was contaminated, that it could be picked up from that surface by our hands, introduced into our body by touch or by what we have picked up on our hands, thus the guidance for frequent cleaning and disinfection of those surfaces.